You are most welcome to this talk. Now, this video is about the possible relationship between COVID mRNA vaccines and the development of cancers that affect the hemopoietic system, the blood forming system, things like the bone marrow that can lead to lymphomas and leukemias. We'll be looking at a case study, and we'll also be looking at the plausible mechanisms. So this paper I'm going to discuss identifies quite a lot of plausible mechanisms whereby the mRNA lipid nanoparticle vaccines could, using sound principles of biochemistry, physiology and anatomy, lead to the development of cancers. Now, this is taken from this paper here, peer-reviewed, published in OncoTarget, exploring the potential link between mRNA COVID-19 vaccinations and cancer. So that is what it's going to be based on. Very readable paper. Do check it out for yourself. It does get a bit technical when it talks about the case study, but the introduction in the first part is very readable. And also, we probably won't cover this in this video, but there's also been horrendous problems that the author is going to tell us about. Personal message from the author later on, by the way, or one of the authors. He's actually published something else here on censorship in science. We might be looking at that in the future, not in this video, probably in the next one. And the great difficulty in getting things published if they don't fit the mainstream narrative. Anyway, let's get on with the detail of this paper. And as you'll see, it's a very scientific, rational piece of work. So that's what we're investigating. Hemopoietic, blood forming. Poiesis, the formation of blood. Heme, obviously, blood. And this is the article on censorship in science, the difficulty in getting this information out there. This has been coming for a long, long time. I started talking to this author probably well over a year ago now, and this is just something coming out now. So it's been difficult, but that's the end of the story. Let's deal with the content, and then we'll deal with the difficulty in the process. But he does say only relentless determination gets dissenting data published in peer-reviewed journals, and by dissenting, I would say analytical, because this is an analytical article. The article is scientific, and as indeed has been peer-reviewed as such, and is written by significant scientists. Now, case study. There's a case study here. Healthy young athletic woman, very athletic actually. Developed acute lymphoblastic leukemia and lymphoblastic lymphoma shortly after the COVID vaccine. So to get one is indeed unfortunate. To get two at the same time, well, I'm not a specialist in this. I'm not a haematologist by any means, but I've never looked after a patient who's had both at the same time as far as I can remember. If you're in the field, do let me know, but I think it's very unusual to develop both at the same time. But this was both following a second dose of the Pfizer COVID-19 vaccine in July 2021. Now, no, that's right. Going on from this, she had... I'm not going to go through the details of the story, but basically, let's say she suffered a lot for a long period of time. And then in 2025, she had some preparatory drugs and what you call total body irradiation. So her body was irradiated to kill all the bone marrow. And of course, when you kill all the bone marrow, you kill all the malignant bone marrow. Very dangerous thing to do. Obviously, I have seen patients with this, and we have to be remarkably careful that they don't get infections. And then she was given a bone marrow transplant from an unknown donor. And at the moment, she is doing quite well. But that's a pretty invasive treatment, and she suffered for a long time. So she had a cell transplant from an unrelated donor. Now, this article is part of an expanding body of literature documenting similar occurrences after Moderna RNA vaccinations, according to this paper that we're discussing. And I agree, I've been seeing these around for some time now. Now, the authors do point out that there's 30 papers describe malignancies developing in close temporal correlation with Moderna RNA, modified Pfizer and Moderna, modified ribonucleic acid, COVID-19 vaccination, and sometimes that temporal correlation in time, in other words, that the cancer occurs just after the vaccine, or sometimes just a few days. And of those 30 papers, 28 focused on hemolymphoproliferative disorders, in other words, leukemias and lymphomas, basically. And in 4 cases showed onset at the inoculation site. So the first sign of the disease was where the vaccination had been given. And another 3 were from the lymph nodes. So like if you were given the injection in the deltoid there, that would be drained to these lymph nodes here. 3 cases of the hemopoietic malignancies presented in those lymph nodes. 4 at the site. Coincidence? You tell me. I would have thought not. Yep. So that's 7 close temporal correlations. Now in Japan, leukemia, breast cancer, lip and oral pharyngeal cancers increased significantly in 2022. Now this is published in this paper here. And of course, we did review this at the time. And let me show you this paper from Japan. Here it is here. We see increasing age, adjusted cancer mortality after 3rd mRNA lipid nanoparticle vaccine dose during the COVID-19 pandemic. Oh, it's been retracted. Oh, that article's been retracted. That retraction may not surprise you. There's been a lot of retractions of various papers. When I looked at it at the time, I thought it was a good article, I must say. But here's the notification of the retraction. So it appeared to be showing increased cancers in Japan at a population level, but it was retracted. So technically we can take no account of it because it's a retracted paper. So, as the authors of this paper that we're currently looking at, with Dr. Polykritis, in that article they do notice that there's a critical literature gap, indeed critical literature gap. Absence of population studies varying cancer incidence by vaccination status in order to estimate the true cancer incidence and mortality following COVID-19 vaccination. So we are desperately short of this literature. Now we know that the British government, for example, does have the vaccination records for people that were given COVID vaccinations. We know they have record of the deaths, the excess deaths in 2021, 2022, 2023. And we know the number of people vaccinated, and we know the excess deaths. Lots of people were vaccinated and there was a huge amount of excess deaths. The government won't release the data that shows which of those excess were vaccinated. Now, they have to release that information to the pharmaceutical companies, so they know, but we don't know. So papers are being retracted. Data is being officially withheld by governments. Make what you want of that. But the result is that we are very short of literature. Now, technically, of course, the vaccines are prodrugs, so that they're not actually drugs themselves, they're prodrugs. They come before the drug. And the gene therapies, encased in the lipid nanoparticles rather than natural naked RNA. So some RNA will get into the circulation from time to time, but it's naked, and therefore it's disposed of probably in seconds, certainly within minutes, by the immune system. But if it's in these lipid nanoparticles, it can't get to it. So it's protected. The genetic preparations are protected. Emerging evidence suggests that biodistribution and persistence of modified RNA facilitated by lipid nanoparticles can affect various tissues and organs. And we now know that these lipid nanoparticles are systemically distributed. And we know that an awful lot of them go to the bone marrow, where the cells can become malignant that cause leukemia and lymphoma. It all starts to make potential sense, but much more evidence to come as we go through. So it can go everywhere. It can go to your ears, your toes, your nose, your eyes, your heart, your lungs, your brain, everywhere. Your liver, your kidneys, your intestines, including the bone marrow and other blood-forming organs for sure. So we know these lipid nanoparticles go to the blood-forming organs, where the blood-forming cells are. And if these cells become damaged, mutated, damaged, they can become leukemic or lymphomic cells. I like the turn of phrase the authors use, unfettered access through most tissues and organs. They can just go where they want. The lipid nanoparticles means that the lipid nanoparticles themselves and the modified ribonucleic acid is well and truly off the leash. It can go anywhere. This is why we need a moratorium on these vaccines, genetic preparations, for now, until we know a lot more. Notably, modified RNA vaccines exhibit a particular affinity for the bone marrow, so particularly likelihood that they will actually go to the bone marrow, which of course is particularly concerning, potentially influencing the immune system at multiple levels. So if you affect the bone marrow, you affect the immune cells, then first of all, you can reduce the amount of immune cells, and that means that the immune system is no longer checking all the cells in the body all the time to make sure none are going malignant, because what happens is most of us most days get cancer, but thankfully at a very early stage the immune system eradicates it, so that immune surveillance can be reduced. But as well as that, if you cause malignant changes in the cells, then instead of getting normal white blood cells, you'll get cancerous, malignant white blood cells, which are no good at all. So the irony is that in leukemia, leuc means white, the blood is full of white cells, but they're malignant white cells, so the patients can die of infection because the cells are no good, they're malignant, they no longer do their job. So it can work both ways once the bone marrow is affected. I'm afraid it does make a lot of sense. Triggering both autoimmune disorders and neoplastic processes. So it can cause autoimmunity where the body beats up on its own tissues, and new plastic tissue, in other words, cancer type issues. Neoplastic processes, new tissues are made. If it's in the blood, then the new tissue is the white blood cells and the lymphoma cells that can go all over. And of course, in solid tumours, you can feel the new tissue. By integrating clinical observations and current research, that's good, that's what they do in this paper, we aim to provide valuable insights into the potential carcinogenic outcomes associated with modified RNA vaccines. So, quite a lot of detail there already, but there are real mechanisms here. Let's just quickly run through some of the mechanisms. Now, some of them are straightforward, some of them are more complicated biochemistry. I'll just give them a brief explanation, but if you haven't got time for the rest of this video, suffice it to say there are plausible pathogenic mechanisms of cancer causation in the bone marrow as a result of mRNA lipid nanoparticle vaccines. So, potential cancer-causing mechanisms, oncogenesis, carcinogenesis. We know that spike protein is toxic. And vaccine-induced spike protein lasts for longer than the natural spike. So the natural spike protein will be recognised and dealt with by the immune system quite quickly. The synthetic spike protein hangs around for much, much longer, and indeed for very long periods of time. Indeed, in some cases we've looked at. From memory, I think one case was 700 days, from memory. A double proline that confers greater stability. So there's greater stability in the spike. Not going to go into the biochemical details in that. Don't fully understand it, but the biochemists assure us it's true. We can believe them. And what we also know the synthetic pseudouridine. So the uridine base is synthetic, contained in the modified RNA. They didn't use the normal uridine base; they used a synthetic one, and that's shown mitochondrial toxicity, amongst other things, and a resistance to being broken down by the immune system. It's been demonstrated that this modification can increase the likelihood of +1 ribosomal frame shifting during translation. Right, let's explain this briefly. Some of you know, a lot of you know already, but basically when the DNA message or the RNA message is being so when the RNA message is being translated into proteins, three bases in the RNA codes for one amino acid. But if you shift those along one, then instead of having amino acids 1, 2, and 3, the ribosome will be reading amino acids 2, 3, and 4. And then 5, 6, and 7. So it'll all be out of sync. It'll be shifted forward one. And that means you get a completely different set of amino acids, completely different set of peptides and proteins. And who knows what that could mean. Not the protein that was intended at all, but all these other random ones, some of which could potentially be cancer causing. Anyway, this frame shifting results in the production of multiple peptides products with unexplored effects. What the heck are these things doing? Don't know, don't really want to know, but we might have to find out, unfortunately, because they may be causing disease. This obviously poses serious safety concerns, as only a single antigen was supposed to be encoded by the modified RNA, according to the paper. But of course, that's completely true. Not many undefined peptides with unknown antigenic, numerous undefined peptides with unknown antigenic and autoimmune potential. So what the heck is being produced by this frame shifting? We don't know. Amyloid proteins could be one of them, which we've looked at in other contexts. The lipid nanoparticles themselves exhibit intrinsic cytotoxicity. So even if the lipid nanoparticles are empty, which they're not, but even if they were, they're still toxic to cells. The lipid nanoparticles themselves are toxic, as well as their cargo. Presence of lipid nanoparticle encapsulated the DNA contamination. DNA contamination originated from the residual plasmid DNA. So from the bacteria that the mRNA was made from, we've got this DNA contamination. And of course, we've looked at this in great detail with Dr. David Speaker from Canada, for example, who did a lot of the original work and has published that, finding very large amounts of DNA contamination in the mRNA vaccines that simply shouldn't they be there. And we talked to Josh Getzko, who realised that most of the vaccine used in the trials was produced in a slow, expensive way. And then they did a bait and switch, and the vaccines that actually went into your arm and mine were produced from these E. coli bacteria that are normally found in the colon. Cheaper and quicker to produce, I believe. Rather unsatisfactory situation, but it left us with this DNA contamination, and we know that is not something that we want by any means. DNA integration may include the risk of tumorigenesis, formation of tumours, if insertion reduces the activity of tumour suppressor or increases the activity of oncogene. So tumour suppressor genes, of course, prevent cancer. There are natural genes that prevent cancer. Oncogenes are genes which, if stimulated, can cause cancer. Now, you might wonder why we have genes in our genome that can cause cancer. Well, we don't, but we have genes that stimulate the development of us from when we were a single cell to when we were a baby ready to be born. We need a lot of growth stimulating genes. And if these genes are stimulated in later life, they still cause growth, but this time, of course, we don't want growth, and that growth becomes malignant. So basically, if the DNA integration is reducing the activity of a tumour suppressor gene, that can lead to more cancer. If it's increasing the activity of an oncogene, that can lead to more cancer. Two mechanisms there by which it can cause more cancers. A few more if you're still interested. Vaccine-induced T-cell immunosuppression impairing cancer surveillance. So the vaccine can suppress the T-cells. And we learned from Professor Angus Dalgleish that these T cells, especially the T cytotoxic cells, are very important for recognising killing cancer cells at an early stage. A big part of the reason that cancer becomes more common in later life is that T cell activity goes down in later life, thereby predisposing us to cancer. But if the vaccines are doing that directly, then that can predispose to cancer by reducing immunosurveillance. Interaction between the S2 subunit of the spike protein and the oncosuppressor proteins. So oncosuppressor proteins come from oncosuppressor genes. Particularly P53 reduces cancer, BRCA1 and BRCA2 reduce cancer. And you probably, BR breast cancer, this was discovered, the BRCA, the BRCA genes. So if you've got a mutation in BRCA gene 1, you won't produce BRCA gene protein. And because BRCA gene 1 protein is an oncosuppressor gene, if you have less of that, then you have nothing to suppress the tumours and you get more breast cancer and ovarian cancer, prostate cancer probably. So people have natural mutations and that get cancers young. But if there's interactions between this particular subunit of the spike protein and these proteins, then it's a very similar effect. We get reduced oncosuppressor proteins, therefore more onco, because the onco is not suppressed, and of course onco is cancer. Yep. The impairment of type 1 interferon signaling, which is all sorts of things, increased transformation of growth factor beta alpha production, vaccine begins to accumulate rapidly, particularly in the bone marrow. So this interferon on things, these are all anti-cancer things that are interfered with, therefore making us more predisposed to cancer. And this will make us more predisposed to inflammation and subsequent cancers. Vaccine begins to accumulate rapidly, particularly in the bone marrow after injection. So between 30 and 48 hours following intramuscular injection, the concentration of radioactive labeled nanoparticles in the femoral bone marrow in rats increased by 7.9-fold. That's just in between 30 minutes and 48 hours. Now, what they did here, you couldn't really do this, well, you could, I suppose, but it was done in rats. You inject radioactive lipid nanoparticles and see where they go, because you can trace the radiation and they go to the bone marrow. And we also know that they do in humans as well, but it's been clearly demonstrated in rats that the lipid nanoparticles scoot off to the bone marrow. 7.9-fold increase in that first 48 hours. Proposed vaccine-induced activation of innate immune pathways, which induce pro-inflammatory cytokines. So basically, the vaccine can increase pro-inflammatory cytokines. Cytokines are chemicals that communicate between cell to cell and increase in this case, pro-inflammatory cytokines increase the amount of cytokines. And we know that if you have more pro-inflammatory cytokines, you have more inflammation, and we know that inflammation predisposes to cancer. It all makes sense. I am afraid it all makes sense. I mean, we first learned about this years ago. Professor 𝐬𝐚𝐢𝐬𝐻 told us about it, leading oncologist, that he's noting in some of his melanoma patients who've been stable for 5, 10, 15, I think one for 20 years after they had the injection, that the melanoma's reactivated. So we've got new cancers appearing, as in this tragically young woman in the case study, and in people that have been managed for a long time, we're getting recurrence of cancers.